Hello friends, welcome to FRCR Physics. Um, Topic effects of filters on patient exposure. So first, there are Trout and co-workers demonstrated the degree of patient protection afforded by film of series of tests which are given in this picture. So, in this particular experiment, they made multiple radiographs of an 18 centimeter thick pelvic phantom using 60 kilovolt peak X-ray beam. The initial radiograph is made without filter and then repeated with increasing thickness of the filters of aluminium. Then the exposure times are adjusted to produce the film with equal density, and radiation dose to the skin over the pelvis were measured for each exposure. So radiation dose was measured for each of the exposure to the skin. So next they have plotted all of them in a table. Okay, so this is the table which shows the aluminium filtration without filter and with filters by increasing the filtration from 0.5, 1 mm and 3 mm. This is the exposure dose and this is the decrease in exposure dose to skin, and this is the decrease in exposure dose. So if you take this table, decrease in exposure dose was remarkable up to 80% with 3 mm filters. So these percentages are for specific examination. So if you see, decreasing the patient exposure dose is maximum up to 80% with 3 mm filters. So on increasing the filtration, the exposure dose to the skin decreases, and this decrease in exposure dose is maximum at around 80% by using 3 mm filters, aluminium filters. The second thing is effect on exposure factors, effect of filters on exposure factors. The major disadvantage of filtration is filters absorb low energy radiation and they cause reduction in intensity of X-ray beam. So the filters also absorb some photons of all energy levels, and we must compensate for loss of high energy photons by increasing the exposure factors. So we have low energy photons, we have high energy photons. On using the filters, the low energy photons are completely absorbed, whereas some of the energy of high energy photons is absorbed. So as a result, the energy of photon is decreased. So loss of these higher energy photons by these filters, to compensate the loss of high energy photons by filters, we have to increase the exposure factors, that is milliampere second should be increased. To compensate the loss of high energy photons, we have to increase the exposure factors, or milliampere second is increased. Even when it is necessary to increase exposure because of the filtration, the patient receives less radiation than normal. Even after increasing the exposure factors, the patient receives less radiation than he would from the unfiltered beam, because the X-ray puts out more absorbed photons and filters absorbs many of them. So the uh, total number of X-rays reaching the patient will decrease. So more energy, more photons are present, filters will absorb some of these photons. So as a result, the exposure is decreased by using filters, even after increasing the milliampere second. So low energy photons are completely absorbed. Then the next important thing is wedge filters. Wedge filters are occasionally used in diagnostic radiology to obtain films of more uniform density. if when the part being examined diminishes greatly in density from one field to the other. Here in wedge filters, the wedge filters are shaped like a wedge. The relationship between filter and the patient is here. So the wedge filters are in the shape of wedge, with one end being the thicker end and the other end being the thinner end. So one side of the patient, so these wedge filters will decrease the photons transmitted from one side over one side, more at one end and less at the other end. So we have to place the patient in such a way that the thicker end of the patient is towards the thinner side and thinner end of the patient is towards the thicker side. So if this is the wedge filter, so a patient is placed below the wedge filter. So patient is placed with thicker end towards the thinner part of the wedge filter and thinner end towards the thicker part of the wedge filter. So this wedge will compensate the difference. Less radiation is absorbed by the thinner part of the filter, so more is available to penetrate the thicker part of patient. Whereas more radiation is filtered by the thicker part of the patient, so less is available for the thinner part. This reduces the radiation dose to the patient. Wedge filters are normally often used in lower limb angiography when one images from the lower abdomen to the ankle with single exposure. So pelvis or hip is placed over the thinner part, whereas the over the thinner end of the pelvis or foot is placed towards the thinner part of the wedge, whereas pelvis or hip is placed towards the thinner part of wedge, whereas the foot is placed over the thicker part of wedge. So this is wedge filters. Thank you.